Let's get started on leadership module number 2. We're going to focus on population analysis in systems. So with that, we're going to really dive into identifying outcomes in population-based nursing, as well as using some of those metrics to actually analyze not only what needs to be done, but also those outcomes as well. And that's part of the evaluation piece that we'll be moving into later on as we move through the course. So we have our leadership outcomes. We're going to look at effective use of healthcare information systems. We're going to look at that collaborative piece, and this is something as DNP prepared nurses that is extremely important to build these skills. These skills, collaborative skills, whether it would be within an organization or within organizations, meaning all the outside organizations, how to make those relationships and how to make them work to have that collaborative impact. So pooling resources together or moving together in a common goal to elevate outcomes. So how can you work with others to elevate outcomes and use the resources that are available in a very effective manner? So these skills will set you apart from other DNP prepared nurses. So keep this in mind as you move forward. The need to think beyond our own locus of control and collaborate with others to improve outcomes. So of course we'll have our virtual module overview. And we're going to really re-envision what true health means. Very often we correlate health with healthcare. In actuality, we need to look at how we're going to shift healthcare, and you as DNP prepared nurses are in a crucial position to be the change as we move forward in healthcare practice. With that being said, we're going to revisit the triple aim and examine those factors specific to the experience of care, population health, and cost, and how all of those factors are really interconnected. And along with the topic of our module and using those metrics, this is the IHI's Guide to Measuring the Triple Aim. So I want you to take a look at this document, and there's some valuable information that will help you as we're moving forward in this particular module, as well as the course itself and in your practice. So with our readings, we're going to really dive into Chapter 2 and Chapter 6. There is a little bit of a review, just kind of refresh in Chapters 3 and 4 with EPI, because that'll bring us back to the content that we gained in epidemiology or in your previous epidemiology courses or review. So when we're examining Chapter number 2, I want you to really focus in on identifying those outcomes, being able to determine the levels of outcomes, and differentiating between individual outcomes and population health focused outcomes. And there are benefits and there are results at the individual basis for population health outcomes. So just kind of keep that in mind. And going broad with population health outcomes really does have that trickle-down effect and does impact individuals. But the focus is on the big picture and more of a general focus. The patient is the population versus the patient being the individual. So just kind of shifting the stance a little bit in the way that we view things, and also examining some of the information that's out there as far as back to some of the concepts of epidemiology, morbidity and mortality, looking at those social determinants of health. Some of the studies that are out there or the databases resources that are out there, such as the Behavioral Risk Factor Surveillance System that's within the CDC. All of those factors will be instrumental as we're examining ways to improve population health by looking at the data. And also, when you dive into chapter number 6, really focus on how to effectively use the information that is out there, so to speak, whether that would be data that's included within an electronic health record system or a major database, a national database. Know what information is available to actually apply to your practice. So again, become familiar with some of the internet sites that are out there, such as the CDC, and I know we've touched on the CDC resources. They're just so immense. So really focus in on your populations that you serve and finding that very valuable data and information that will help to inform the processes, how to examine what specifically are the target areas for your populations to make the greatest impact for outcomes. So again, there are a multitude of issues out there that need addressing. How can we prioritize and think in a very fiduciary sound way to make sure that we use our resources effectively? And again, that brings that collaboration piece. What other organizations are out there, or what other disciplines, departments can you collaborate with to pool your resources to elevate outcomes? So those are some of the top areas to focus on as you're reading. So we're going to move on to resources for success. So here's the content folder, and there's quite a bit of information that will help you as you're doing your assignments as well as the discussion board. So know that there are resources here for you. Take a look at these resources. Goes into those community health assessment tools, and knowing what's in those health assessments really helps to prioritize as well. And there are many, many resources here for some of those metrics that we spoke about, as well as one thing I do want you to strongly consider are those resources grounded in mental health. And too often we focus on physical health that is beyond that is exclusive. And we really need to look at how mental health also plays into physical health, and how physical health plays into mental health as well. So there's some data and information out there that really demonstrates how valuable it is to focus on whole health to really impact those outcomes. And again, that goes back to that collaborative piece that is so important, to connect with those organizations that have those specialty structures such as mental health and behavioral health. So with that being said, let's just take a look at our discussion boards. As we're examining our forum, this forum is specifically designed to help you with your epidemiology at-risk analysis. Apologies, I can't even speak today. So what we're going to do is dive into some of that data. We're going to examine some of those factors that are experienced in the experience of health, as well as examine some of those beyond clinical issues, some of those economics, policies, social determinants of health, and those health behaviors that impact the area of focus, are risk topics. So we want to look big picture and examine those factors in consideration of what you are tending to focus on based on your epidemiological analysis. So we're going to start exploring those opportunities. The other thing is your strategic plan may play into, and will likely play into, where you're examining your area of focus for the epidemiological risk assessment. And the risk assessment serves as the foundation for your final assignment. You're going to be building on your findings of that risk analysis. So what we're doing is we're bringing in some of the information. You're going to be discussing what resources are out there, what is valuable as far as those resources, whether it would be data, regulations, laws, policies, standards of practice. You're going to be discussing those resources among yourselves and give each other tips and resources and nuggets of pearls of knowledge to help each other as you're moving forward with the epidemiological at-risk analysis. So you're also going to be, wherever your area of focus would be geographically, you will be completing a windshield survey, and these are invaluable. It helps us to examine the experience of health beyond, say, a wall within the walls of an organization. So it's going out to where the folks that you serve live, taking a look at where they live, what are their experiences in regards to health, and really putting that into play when you're examining that experience of health, because we know that in an acute care organization or in a particular facility, very often they're there for just a very small percentage of time, and their experience of health is outside of that particular organization. So we need to look at what are those environmental factors, those social factors that impact health outside of an organization, because that informs us on how we can better serve those while they're within an organization or a practice, and helps us to get the big picture of the experience of health. So I look forward to sharing the conversations with you, and please note that there is one forum in module number 2, and part of module number 2 allows you time to really dive into your epidemiology at-risk assessment. So let me know if you have any questions or concerns.